So, your doctor just prescribed Trajenta? Well, you've come to the right place. In this quick guide, we're going to break down everything you really need to know, nice and simple.
You know, starting any new prescription can feel, well, a little overwhelming, right? There's a new name to remember, a new daily routine to get used to, and it's totally normal to feel like it's a lot to take in.
But that's exactly why we're doing this. Trajenta was actually designed with simplicity in mind, so let's take a look at what that actually means for you in your day-to-day.
Okay, first things first, let's cover the most important part. How you actually take it. This is all about making it a super easy part of your daily life. Honestly, it's as straightforward as 1, 2, 3. First, the dose is always 1 milligram tablet. Easy. Second, you just take it once a day. The real key here is trying to take it around the same time every day. That helps keep a steady level of the medicine in your system. And third, just swallow it whole with a glass of water. No crushing, no chewing. Simple as that. Now, here's one of the really great things about Trajenta. It's flexible. You can take it with food or without food, whatever works best for you and your schedule. But, and this is super important, if your doctor has you on the combination pill, the one called Trajenta Duo that has Metformin in it, you have to take that one with a meal. It really helps prevent any stomach issues. Of course, life happens. We're all human, and sometimes we just forget things. So what do you do if you realize you missed a dose? Okay, the rule here is very clear. If you remember pretty soon after you were supposed to take it, go ahead and take it. But if you look at the clock and it's almost time for your next dose anyway, just skip the missed one. Just get back on track with your next scheduled pill. The #1 most important rule, you can see it right there in bold, never, ever take 2 doses at once to catch up. So now that we've got the how down, let's get into the why. What makes Trajenta stand out from other similar medications? This is its secret sauce, if you will.
So most drugs in this class, they're called gliptins. They get cleared out of your body mainly through your kidneys. And because of that, you can see on the left, the dose often has to be changed if a person's kidney function goes up or down. But look at Trajenta. It's different. It takes another exit route. It's cleared out mainly through your bile and your gut.
And this unique pathway is what gives Trajenta something called the kidney advantage. For a lot of people, that different pathway is a really big deal. So what does this kidney advantage actually mean for you? It means your dose is just consistent. It's 5 milligrams. That's it. It doesn't matter what your kidney function is doing. No complicated math, no adjustments needed from your doctor. It's designed to be that simple.
Okay, let's shift gears for a minute and talk about something that's absolutely crucial with any medication: safety. Let's cover the most important thing you need to be aware of when you're taking Trajenta.
Now, while the risk is pretty small, all medicines in this class have a serious warning for something called pancreatitis. That's just a fancy word for inflammation of the pancreas. And because it's serious, you absolutely have to know what to look for.
So there are 2 things you need to burn into your memory: the signal and the action. The signal is a severe stomach pain that is persistent. It just won't go away, and you might even feel it spreading around to your back. If that happens, the action is immediate and non-negotiable. You stop taking the medicine and call your doctor right away.
All right, for our final section, let's look at how Trajenta plays with others. It's not always used alone. A lot of the time, it's part of a team of treatments.
So like we mentioned before, Trajenta is often combined with Metformin in that single pill, Trajenta Duo. And remember, that one always needs to be taken with food. It's also frequently used with insulin. If that's your situation, don't be surprised if your doctor lowers your insulin dose a bit. That's done on purpose to help make sure your blood sugar doesn't dip too low.
So let's boil it all down. If you remember 3 things, make it these. Trajenta has a super simple once-a-day dose. It has that unique kidney advantage that keeps the dose the same for everyone. And you need to know those clear, very important safety steps.
And that brings us to a final thought to leave you with. After everything we've talked about, think about this. Why might a doctor really lean towards prescribing Trajenta for a patient whose kidney function isn't what it used to be? The answer is its biggest advantage. Thanks so much for tuning in.